Patrick, we started the Building the Odyssey Evidence Network sprint in July. We had two great sessions. People can go back in this newsletter, the videos of both sessions. But I wanted to touch on in your first, in your kind of introductory talk, you brought up a recent study and used it as an example, and we're seeing it happen right now of how the Odyssey Evidence Network can really contribute to our community mission.
Yeah, the Odyssey Evidence Network is an important priority for us right now because we need to identify what data sources are part of our community who are willing to participate in network studies. And we need to create a mechanism whereby participation of data partner organizations, it's very clear how do they participate, what do they get out of it, and how do we connect researchers with important clinical questions to data sources that are fit for use to answering that question. At the start of the month, there was this paper that was published in JAMA Ophthalmology that speculated about the potential risk of semaglutide in a rare form of blindness. And in that paper, it was the typical thing we commonly see in the literature, a single site conducting a single analysis with very small numbers and producing an estimate that actually got disproportionate amount of wide mainstream media attention. And that study ended with a statement that says more research is needed, but who in the world is going to do that research? Even though semaglutide is probably the most important drug in the world today, and clearly with millions of patients being exposed to this drug, understanding whether or not it causes visual defects is critically important to public health. And yet there really isn't anybody out there who is as well positioned as we are as an Odyssey community to respond. So I'm really glad to see that our eye care and vision work group has taken that challenge on, has initiated a network study, and that we're actually able to capitalize on our Odyssey Evidence Network to design and execute a study that will be able to deliver reliable and responsive evidence to meet the charge raised by that paper only just 3 weeks ago.
People can learn more about that study and the Odyssey Evidence Network in this newsletter. The Evidence Network was first introduced at the Global Symposium last year. Another big part of last year's symposium was that How Often workshop, and it was really great this month to get an update, to learn about some of the ongoing projects around How Often, and also some of the next steps that the team is thinking about. What stood out to you about that session and the entire initiative?
Yeah, when we highlight the paper from JAMA Ophthalmology, it's a single hypothesis about a single drug and a single outcome, which of course has tremendous value. But what the How Often team is really trying to recognize is that holistically, there are thousands of drugs and thousands of outcomes out there, and we need to be able to understand how often those outcomes occur to any patient exposed to any drug. And so the work that Cindy and Elise and Aza and George presented about the How Often Initiative demonstrated how it's possible across our Odyssey Evidence Network to be able to generate evidence at scale, not just testing one hypothesis at a time, but actually generating a large-scale evidence resource that can answer a bunch of different questions. So it was really great to hear from Cindy about how we learned about the impact of indication. It was great to see from Aza how we can actually start to understand the incidence of health service utilization across different populations. And it was also great to hear from Elise about how we can learn from the incidence computed from clinical trials and then compare that to real world evidence to make sure that the How Often Initiative and other large scale efforts that we do in the characterization space can be really considered to be reliable evidence that people can count on.
How Often, a great example of characterization work in our community. That's one of the three pillars of Odyssey. Another is prediction, and we were fortunate to have the leads of our prediction work group, Jenna Reps and Ross Williams, put together a session at the end of the month to highlight what is being done in prediction. Can you just talk a little bit about, because we don't do a lot about prediction on these podcasts, a little bit about kind of what is happening and the importance and value of our prediction work in terms of real world evidence?
Well, our three analytic use cases that we focus on in the community is to characterize with descriptive statistics for disease natural history, treatment utilization, and How Often is a good demonstration of large-scale characterization. We focused a lot on estimation to think about safety and comparative effectiveness of interventions, and we've seen large-scale efforts in our community, such as the Legend initiative that we've done. In patient-level prediction, we can think about the application of machine learning algorithms for questions of disease interception and precision medicine. The real particular challenge is, for all of the hype about machine learning and artificial intelligence, there really aren't fully established scientific best practices about how to develop models, how to validate models, and how to actually apply them both within an individual institution as well as across a network. And I'm really proud of the work that our patient level prediction work group is doing, because they really are trying to establish some of those foundational best practices. We've seen a collection of papers come out of through the leadership of our PLP group. And even just earlier this year, we've seen some really pivotal works about how to select specific algorithms, how to actually understand when those algorithms work. And in particular, most recently, how to understand with the efforts towards explainable AI and the advent of larger scale models like deep learning, when should we be buying the hype and when should we be focusing on more grounded traditional methods? Some of this works have been published, and what was really exciting to hear was also some of the ongoing collaborative projects that are going on in the community. I think that what we're going to see is that these aren't three disjoint sets of work, but really anytime you're asking a question about, I would like to understand a disease better and I'd like to understand the impact of it, you want to characterize that question to understand who has the disease and what's the incidence of how often an outcome happens. You want to do causal inference to understand, does an intervention actually cause that outcome? But ultimately, all of us as patients want to know what's going to happen to me. And I think that the foundational work that our PLP group's doing is really allowing us to leverage the real world data we have to provide valuable and actionable insights. But that's got to be grounded in best practices that the team's well on their way to establishing.
I know we should see some of the work that's being done in prediction at the Global Symposium this coming October. We're going to have a session around the symposium this month. We will have more on the OHDSI Evidence Network's sprint. So a lot of great work coming this month. Hopefully people will continue to join us on our Tuesday community calls, learn more throughout this newsletter. Thanks for joining, Patrick.
Thanks, Craig. Science!